Medical practices are drowning under the weight of prior authorizations. This is an active, systemic drain on clinical bandwidth, staff resources, and practice revenue. Data from the American Medical Association reveals the exact scale of the problem. As of 2024, the average medical practice is submitting 39 prior authorization requests per physician every single week. This diagram of a standard 40-hour workweek shows exactly what that volume costs a clinic. Physicians and their staff lose an average of 13 hours a week managing these requests, pulling them entirely out of active patient care. The impact on the actual medicine is measurable. 93% of physicians report that this administrative bottleneck directly delays access to necessary care for their patients. Workflows that were designed for an occasional administrative check have completely collapsed under the sheer volume of modern payer demands. When we isolate Aetna's internal data, the risk to your practice becomes significantly more pronounced than the rest of the industry. This bar chart illustrates an analysis of Medicare Advantage prior authorizations by KFF. Aetna rejected 11.9% of their requests in 2024. That sits well above the market average of 7.7% and dwarfs competitors like Elevance and Humana. This funnel tracks millions of industry-wide denials. Of 4.1 million rejected requests, an incredibly small fraction, only 11.5%, were ever appealed. But look at the base. When practices submit an appeal, 81.7% of those denials are overturned. Most doctors abandon these winnable cases because the peer-to-peer process is heavily flawed. Only 15% of physicians believe the reviewers on the other end of the phone are actually qualified to make the clinical call. Walking away from an unappealed Aetna denial is a direct, voluntary transfer of uncollected revenue right back to the payer. Practices struggle because they treat Aetna as a single, uniform payer. It operates as a complex, highly fragmented system. This model represents Aetna's 3 distinct plan types: commercial, Medicare Advantage, and Medicaid. Each operates its own portal, and each rotates its own specific medical necessity policies every single quarter. When Aetna rejects a claim for insufficient documentation, the clinic often provided the right clinical evidence. The denial happens because the staff uploaded it in the wrong format or pasted it into the wrong portal field. To fight this, 40% of practices now hire dedicated prior authorization staff. But front office turnover is high, meaning clinics are constantly resetting a very steep learning curve. Throwing rotating human capital at an ever-changing algorithmic maze is a mathematical dead end. High-volume enterprise practices have stopped trying to untangle the knot internally. They are completely severing the prior authorization function from their in-house staff. An outsourced model like Staffingly attacks the problem with AI. Their system uses AWS Bedrock to instantly read the patient chart and pull the exact current Aetna policy required for that specific plan. This visual shows how AI classifies documents. The system drafts submissions automatically, handling 80% of keystrokes without error. Once structured, a credentialed specialist reviews the draft, handling the critical 20% demanding clinical judgment. The entire workflow happens securely within your existing EMR through an encrypted VPN, entirely eliminating the need for data re-entry. Technology executes the speed and formatting. Human specialists secure the clinical approval. It dismantles Aetna's complexity matrix entirely. The immediate operational upgrade is speed. Staffingly's model turns around standard Aetna requests in 4 hours and expedited requests in exactly 60 minutes. This speed is crucial for the new CMS 0057-F federal mandates taking effect in 2026. The law legally limits Aetna Medicare Advantage to a strict 7-day standard decision window. The most critical part of that mandate requires Aetna to provide a highly specific reason for every single denial they issue. Staffingly's structured workflow instantly weaponizes those exact denial codes. By mapping the specific rejection reason directly to the appeal framework, they systematically overturn the denials. These new federal rules are a highly effective tool that forces payers to release revenue they previously kept trapped. The choice to outsource ultimately comes down to the raw cost of your current operations. This scale maps out the old model's true weight. With salary and turnover, an in-house coordinator costs between $55,000 and $84,000 yearly. The Staffingly alternative shiders that overhead. At $399 weekly, an expert team costs about $20,700 annually. The onboarding process is entirely frictionless. The team is fully HIPAA and SOC 2 compliant and can be actively processing your cases within 5 to 10 days. Stop the financial bleed. Book a demo today to start your 2-week risk-free pilot.